my name's Anna. I am a registered dietitian, and today we're going to talk about a disease you may have never heard of and definitely did not know that nutrition can help fix. This condition is called Auto-Brewery syndrome or fermentation syndrome. In other words, a person produces alcohol inside their body by themselves. This is a very rare condition, and it's a result of what we call gut dysbiosis. So that's when your microbiome in your large intestine is out of whack. Certain funguses and bacteria can cause this condition, though most commonly this is caused by an overgrowth of yeast, kind of like a really extreme yeast infection. Individuals with auto-brewery syndrome eating any form of sugar, so that means simple sugars as well as complex carbohydrates, will result in fermentation and will turn those sugars into alcohol. As a result, they become drunk. Very, very drunk. This is quite a difficult condition, especially because often socially people don't realize that folks that have this are not actually drinking. They themselves are producing the alcohol that's in their body. So if you have a patient and they told you that they have not been drinking, but their blood alcohol levels are through the roof, this is a condition that one might need to consider. Usually treatment involves using antibiotics as well as antifungals for an extended period of time, right, to get rid of that bacteria, but alongside it, dietary treatment is absolutely necessary. To treat this, we use a low carbohydrate diet as well as a high protein diet to go with it. These dietary changes are absolutely vital for the period of time in which a person is getting the medical treatment. This is because we want to starve the bacteria that is fermenting the sugars into alcohol. So again, during the actual antibiotic treatment, you are also on a low carb, high protein diet. After antibiotic treatment is completed and all symptoms of the auto-brewery syndrome go away, then a person can often return to their normal diet, preferably with changes to make it a more balanced diet. I say this because often individuals who develop this condition have previous history of some sort of gastrointestinal disorder, such as IBD or IBS, and they often have a history of eating a very high carb diet that is low in protein and fat and the very, very necessary fiber. Unfortunately, people often relapse, and it is very vital to make sure that you don't develop this condition again and again and again. Again, a balanced diet would help. A low carb diet would also help. But then also trying to avoid the unnecessary use of antibiotics, as that can dysregulate the gut microbiome. Alongside these dietary treatments and medical treatments, you also need to be on a prebiotic and a probiotic, as this will help repopulate your gut microbiome. When you use antibiotics, it kills the good bacteria inside your gut, and it increases the risk of bad bacteria taking over. But we can talk about those things in another video. So there you go, auto-brewery syndrome, a condition you probably haven't heard of, is quite rare, and you probably definitely did not know that dietitians can treat.